is Nicole Klaus. I'm an RN with 6 years experience in a psychiatric hospital. We will later be joined by Nicole Wenstrom, CNA, who has 12 years experience in home health care and in a psychiatric hospital. The following lesson will teach you the SAFE model, influence on client feelings, what we can do to prevent problem behaviors, and we'll finally discuss signs of problem behaviors such as depression and suicide, agitation, and wandering and confusion, and how we can best help those clients who are experiencing these behaviors. We're going to look at the SAFE model. The SAFE model stands for Staff Actions Equal Fewer Escalations. The model stands for all of the influences on our feelings and our clients' feelings impact our behavior while they impact our patient's behavior. And then our behavior impacts patient behavior while patient behavior impacts our behavior. If we have effective interventions, we can possibly reduce acting out behavior, while if we don't have effective interventions, we may have acting out episodes. Behaviors are verbal or nonverbal actions by staff or clients. Feelings are internal emotions of ourselves and of our patients. Behaviors or actions are symptoms of feeling, and it's very important to always remember what feelings are behind the behavior. Some of the influences on feelings that can cause acting out behaviors include medical conditions such as pain, medication, urinary tract infection, and constipation. Confusion, losses such as privacy, body function, freedom, family and friends. Stress, time of day, sundowns, weekends, sometimes nighttime can be a difficult time for patients. A break in routine can be a difficult time for patients. If patients are used to a certain event occurring at a specific time of day and we change that, that may cause a change in their behavior. The environment has a big impact on behavior. Staff, peers, the building setup, their surroundings, all of those different things can impact their behavior. Noise level is another thing in the environment that can impact a patient's behavior negatively. And now we'll go to Nicole Wenstrom, who will talk about communication, professionalism, and self-care.
When communicating with clients, the first thing you need to do is consider special challenges the clients may have. Ask yourself, does the patient have a hearing impairment? Are they easily confused? Next, take note of your environment or your surroundings. Specifically note noise levels. To reduce environmental noise, turn down TVs, radios, and electronic equipment before beginning your cares. If the patient is in a common area which is loud or chaotic, move the patient to a more quiet environment before beginning to communicate with them. There are two basic types of communication that we want to take a look at today. One is nonverbal and the other is verbal. When communicating with a patient, introduce yourself and let the patient know how you will be assisting them. Speak clearly, avoid mumbling, and give good eye contact. If a patient is confused, try to use shorter sentences and slow your pace. Avoid communicating and asking the patient questions while your back is turned to them. Speak directly to the patient and communicate what you are doing at all times. In addition, we need to be conscious of our nonverbal communication techniques, facial expressions, body language, and work pace. Always greet your patient with a smile. Avoid scowling or rolling your eyes. Be aware of hand placement and body language. If a patient is becoming anxious while giving cares, slow your work pace. This shows the patient that you are aware of their feelings and can help put the patient at ease. Another part of providing quality care is being a professional. We must always realize that our feelings and behaviors influence the feelings and behaviors of our clients and coworkers. Remain calm and consistent. Communicate. Use appropriate verbal and nonverbal communication techniques. Use your team. Utilize team members as resources. Incorporate good patient care ideas from your team members into your daily routine. And understand your client. Know and understand the patient and any special needs that they may have. Lastly, we need to take a look at taking care of ourselves. Be aware of nonverbal behavior. Be aware of verbal behavior. Take a breath. Take a moment to organize your tasks in order to help you manage your day better. Talk with team members and debrief. Talk or debrief with your coworkers away from patient care areas. Communicate challenges, ask for help, and support your coworkers. Finally, take your breaks. Now we'll go back to Nicole Klaus, who will discuss problem behaviors.
Now we'll take a look at some of the specific problem behaviors. The first one that we'll look at is depression and suicide. People that are high risk for this include white males over the age of 65 who live alone, anyone over the age of 75, people with a recent diagnosis of a terminal illness, including cancer, people suffering from recent loss of a spouse. Some of the signs and symptoms you may see are frequent crying, agitation, someone who stays alone when they usually participated in a lot of things with other people. You may see a change in eating and a change in weight. You may see someone gain a lot of weight, or you may see someone suddenly lose a lot of weight. Inactivity, especially when you have someone who is outgoing. And you may see changes in sleep patterns. Somebody may suddenly start sleeping a lot, or somebody may stop sleeping. One of the other symptoms that you may see with depression and suicide is a sudden improvement in mood. This is a very dangerous sign and symptom, and when you see this, it must be reported to your supervisor immediately. The interventions that we can use with the patient that's experiencing depression and suicide include encourage participation in meaningful activities. Encourage your patient to attend groups that may be going on in your programs. Encourage them to socialize with other people. Encourage them a connection with their religious or spiritual expression. Reinforce their sense of self-worth. Give them positive feedback. Offer choices. With the patient that's experiencing depression and suicide, a lot of times loss of control is huge contributions to that depression. Give them choices and allow them and encourage them to make those choices is very important. Allow your patient to do as much as self as possible. Again, control is a very important issue, and a lot of times patients may suddenly experience loss of control and inability to care for themselves. So letting them do and encouraging them to do as much as possible is very important. Look to your patients for advice on issues that affect them, also helping them to increase their sense of self-control. Encourage self-expression, such as singing and drawing. Encourage exercise. Walk with your clients, especially those who require assistance with walking. Watch for dangerous behaviors or dangerous items that clients may have in their area. Make sure that medications cannot be in their reach or anything that they could potentially hurt themselves with. Report any statements relating to death and dying immediately to your supervisor. Any indication that this patient or any statement that is made by this patient that they're intending to hurt themselves needs to be reported to your supervisor immediately. Report any changes in your patient's condition, especially those relating to sleep and eating and statements made by the patient and activity in daily groups to your supervisor. The second problem behavior that I would like to talk about is agitation. Some of the signs of symptoms of agitation include using a loud voice, refusing help from family members or from staff, refusing meals and activities. The agitated patient may be striking out or may be attempting to hurt staff. You may see a person who's agitated pacing. The interventions that you can use with the agitated patient include remaining calm yourself, speak in a quiet tone, use the KISS acronym, keep it short and simple, avoid sarcasm with the agitated client. Make sure that you're respecting the client's space. This will make sure that you're safe as well as respecting the client's space and keeping the client safe. Do not invade their space without permission or without indicating that you may be moving closer to them. Validate their feelings. Acknowledge that they're feeling angry and talk with them about that. Do not rush with the agitated client. Take your time. Talk with them. Explain what you're going to do. Say what you plan to do with the agitated client and receive consent before proceeding. Especially with the confused agitated client, you want to make sure that you're explaining to them what you plan to do and make sure that they know that you're going to put your hands on them if that is what you're going to do. Do not argue with your client or confront the client. Monitor your body language. Make sure you're watching what you're doing. Keeping your hands on your hip or pointing your finger at the client or glaring at the client can cause the client to become more agitated and challenging. Report any changes in the agitated patient's behavior to your supervisor. The last behavior I would like to address is wandering and confusion. Some of the signs and symptoms you may see with wandering confusion are the patient may appear lost. They may not be oriented to time, person, or place. You may see a sudden mood change with this client. This client may be sad and appear to be alone. You also may have a client who rifles through other people's things. Some of the interventions we can use with the confused client include to keep them oriented to time, person, and place. Clearly label their doors with their name. Keep personal reminders near clients, such as a blanket or a picture. Remind clients about important daily events. The one thing that a confused client may do is be confused on the time and may miss dinner or supper or some other type of important event. Refer to additional pages in your student manual for a variety of different measures. And now we'll go back to Nicole, who will talk about the focus model and the golden rules of safety.
In all circumstances, we should remember to use the focus model. First, place full attention on your client's needs. Take the opportunity to support the client. Remain calm. Understand the feelings behind behaviors. And always remain sincere. In addition, always use the golden rules of safety. Never be in a room with the door closed without somebody else being aware of where you are. Use the buddy system if needed. Always inform coworkers of what time and place you are with clients. Always know your client. Always remain calm. If you feel scared, leave the room. And never try to play the hero.
In conclusion, we would like to say that there are a number of influences on feelings that can cause changes in behaviors in both patients and ourselves. It is important for us in the healthcare field to know ourselves, remain professional, and to know our clients. We thank you for joining us and good luck to you in your future career.